Good evening, Mr. Brian and my fellow classmate. Today I'm going to discuss about ethical framework of confidentiality, navigating trust and ethical gray areas in mental health practice. Trust is built on confidentiality as the foundation of psychological practice rooted in the ethical principles, respect for privacy and respect for autonomy to protect therapeutic relationships with the clients. As a psychologist, it's crucial for me to navigate trust of my clients and ethical gray areas in mental health practice that balancing privacy, safety, and legal obligations with safety. Part 1, Conceptual Breakdown: Privacy versus Confidentiality. Privacy is the client's right and ability to control access to themselves and to decide what personal information they want to disclose. For example, if a client chooses not to discuss about his past relationship with his ex-girlfriend during a family counseling, that is called privacy. Whereas confidentiality is the professional obligation in which psychologists' duty to protect all private information gathered during therapy. For example, if a client chooses to discuss about his past relationship with his ex-girlfriend in the therapy, it becomes my responsibility as a psychologist to protect it by not disclose it to anyone. That is called confidentiality. Ethics and APA standards. In psychology, ethics refer to the standardized guidelines and moral principles that guide conduct of psychologists during their practice. Several APA standards are guided by American Psychological Association APA. For example, Standard 4.01 that requires psychologists to protect and maintaining confidentialities of the client's information. Standard 4.02 that requires psychologists to discuss about the limits of confidentialities. And Standard 4.04 the minimizing intrusions of privacy of the clients. Standard 4.05 to governs the disclosure of confidential client information when legally and ethically permitted. Why psychologists be responsible for the burden of protection? As a psychologist, I will be responsible for the burden of protection if clients are present danger of violence. Power imbalance did exist in therapeutic relationships because client trust me as a psychologist, but as a psychologist, I cannot disclose sensitive information due to APA standards regarding to confidentiality. As a psychologist that hold professional knowledge and ethical responsibilities, it is my responsible to protect confidential information and to prevent any harm of my clients. Part 2, Protocol and Informed Consent, Limits of Confidentiality. As a psychologist, I should uphold the APA standards regarding to confidentialities, but it is legally and ethically to break confidentiality under specific circumstances. Confidentiality may be broken when risk of harm or dangers to self, risk of harm or dangers to others, child, teenage, and domestic abuse, court orders or legal requirement, professional consultation, or even when disclosure of information is necessary but only the minimum information should be shared under specific circumstances. Informed consent before therapy begins. Before the first session of therapy begins, as a psychologist, I should clearly explain confidentiality to my client before signing the informed consent document. This includes what is the meaning of confidentiality, what is the legal or ethical limits of confidentiality, how records are documented, who can access those records, and what is the client right. Signing informed consent is a useful method to ask whether clients to explain what is the meaning of confidentiality by using their own words based on their understanding before they sign the informed consent document. So as a psychologist, I should use clear and simple language. Avoid using complex jargon, encourage questions from the clients, and to confirm the understanding from the clients. Part 3, the scenario analysis, the ethical dilemma. This is the example of the scenario. School counselor treating student with anxiety. Principal demands full therapy notes. Reason: student safety for field trip or sport event. Let us examine a common ethical gray area. As a school counselor treating a student for anxiety, the principal requests me to prepare a full section notes to determine whether the students should be allowed to participate in the school event or not. So they have two important ethical principles: student privacy versus school safety. What should the psychologists do? First, the psychologists should clarify the purpose of the requested release of therapy notes and should decide whether the disclosure needs legal obligations, need to consult ethical standards, or need to prioritize confidentiality of the students. And the APA standards apply, such as Standard 4.01 required maintaining confidentiality, Standard 4.04 required minimizing unnecessary intrusions of privacy, Standard 4.05 allowed disclosure only with valid consent or legal justification, Standard 6.02 require maintenance, dissemination, and disposal of confidential records. Full therapy notes contain private and confidential information of the students beyond the school legitimate safety concern. Releasing complete information of the records may violate ethical obligations. Breaking confidentiality is needed when the duty to maintain privacy is challenged by an immediate threat of harm or legal obligations, when the consent is legally and ethically permitted or required in certain scenarios. Ethical response to the school. Best ethical response is do not release full section notes. Instead of obtain students or guardian permission, share minimal necessary information for safety concerns, provide a brief professional risk summary, not detailed therapy records. So as a psychologist, may mention whether the student is safe to participate school events and recommend accommodations without revealing private information. Advocacy and safety balance. As a psychology, I will be responsible to advocate for students' privacy by limiting disclosure of safety, private, and confidential information, by recognizing the school legitimate concern, necessary to educate the school administrator with clear APA standards guideline regarding to the ethical concerns, especially the confidentiality, focusing on safety relevant data only. The purpose is to protect student dignity and support school legitimate safety concern. Part 4, the safety valve. Confidentiality must be broken when imminent risk of serious harm, duty to protect, imminent danger to self, imminent danger to others, mandated reporting of abuse on the lab, abuse reporting, or court orders and legal mandates. Rules is to disclose minimum necessary information. So, conclusion. To be professional psychologists and therapists, we must know and clearly understand ethical codes, explain limit confidentiality, document important decision or record, seek consultation when needed from supervisors, protect trust and client's dignity as well as client safety. Tips on being a confidential therapist: respect client privacy and confidentiality, provide unbiased and culturally competent care with the clients, follow ethical standards to build trust and credibility, and to maintain the integrity of the profession as a psychologist. Thank you.